Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about a very common problem in women, and that is white discharge. Most women get white discharge at some time in their lives, and it's such an embarrassing topic that it takes them a long time to go to a doctor and confess that they have this problem. The white discharge occurs in women usually after the age of puberty because of the action of the hormones estrogen and progesterone on the uterus. They cause some secretion to lubricate the vagina and to actually prevent infection. But white discharge can occur at any age. Newborn babies can develop white discharge, and sometimes it may be a little bit blood stained. This occurs in the female child because of the action of the mother's hormones on the child's uterus and vagina. Nothing needs to be done for this, and if it is just absolutely left alone, it clears up within around 10 days. Later on, young girls who have not yet attained puberty may develop white discharge, and that is because they insert things into the vagina like stones or peas or any other foreign object, and this causes an infection and white discharge. Foreign bodies may also remain in the vagina in older women because they forget that they have put a cloth or cotton there during the menstrual flow. Usually what happens is, under the influence of hormones, menstruation lasts from 1 to 5 days, and from day 6 onwards there is some amount of white discharge. A normal white discharge does not have any smell, it does not have any color, and it does not irritate or cause itching. If you feel that you have more white discharge, please consult a physician. They will be able to check to see if you really have abnormal discharge, and they need to do some tests like a pap smear and a check of the discharge to see what organism is causing it. If a person has taken a course of antibiotics or is on cancer treatment, or has taken some other medication, even oral contraceptive pills, the organisms which inhabit the vagina change, and so they may get a fungal infection. Fungal infection is by the Candida group of organisms, and it causes an itchy white discharge, which is usually odorless. Tablets can be taken for this, pessaries can be inserted, or ointments used. But please remember to take whatever treatment has been prescribed for the entire duration. Don't just apply the ointment once or twice and then decide you're all right and stop, because then it may return. Another very common cause of white discharge is the organism Trichomonas vaginalis. This causes a frothy greenish yellow discharge which also has an odor. Now this is transmitted from one partner to the other. So if you develop this infection, both the partners may need to take treatment or condoms may need to be used. Sometimes antibiotics cause an overgrowth of the woman's natural vaginal flora, causing a condition called bacterial vaginosis. This also produces a fishy odor and irritation, and this also can be easily treated once it is diagnosed. Urinary tract infection means that there are bacteria coming out in the urine, and since the urine passes out very close to the vagina, these bacteria can get into the vagina and cause an infection. There's nothing to be embarrassed about white discharge, but it is important to get proper treatment and to take it for the entire duration that the doctor has prescribed. Meanwhile, while you're waiting for the tablets and ointments to work, you can try sitting in a basin of warm water to which you have added salt, 1 tablespoon of salt and 1 tablespoon of vinegar. You can also take 30 ml of freshly made homemade curd on an empty stomach in the morning to repopulate your vagina with good bacteria. This is Dr. Gita Mathai signing off. If you liked what you heard, please subscribe to my channel and press the bell button. The same content is available in Tamil. Thank you.